We've all heard this Senate health care reform bill referred to as the Louisiana Purchase because of the special $300 million provision in it related to our Medicaid match rate. Quite frankly, Mr. President, I don't much like that nickname for two reasons. First of all, the fact that we in Louisiana have to pay a higher Medicaid match rate under present law because of the hurricanes is a real inequity, which I support fixing. It's a shame that the merits of that fix, which are very real, have been completely lost in this debate because of the way this Louisiana fix has been used and abused, quite frankly, in trying to pass this mega bill. But secondly, Mr. President, I don't like the phrase because it suggests that Louisiana in general would fare very well under the bill overall. And really nothing could be further from the truth. This bill overall sells Louisiana short. It sells Louisiana out. But, Mr. President, that's not all of the picture. It's not even all of the Medicaid picture. Because besides that fix, in the bill overall, there's a dramatic expansion of Medicaid, a huge expansion, and Louisiana state government and Louisiana taxpayers have to help pay for that expansion. And that extra cost to the state government, to the state taxpayer, is way more than the $300 million benefit. I'm particularly concerned about Louisiana seniors. Of course, Louisiana seniors, like seniors everywhere, depend on Medicare. They've paid into it their whole lives. This bill, it's a simple fact. It's confirmed by the Congressional Budget Office, nonpartisan. This bill cuts Medicare $466 billion for that oft-repeated promise that no one who earns under $200,000 will be affected. Well, again, think again. The Joint Committee on Taxation, nonpartisan, has said 42.1 million Americans earning below $200,000 will get a tax increase over the next several years. 42.1 million. That means hundreds of thousands of Louisiana taxpayers will be hit, will get a tax increase. I'm talking about folks who earn well below $200,000. There's also another big problem here, which is an incentive for businesses to drop coverage. I mentioned that brand new mandate. Either you provide a government-defined health benefit or you pay a new tax to the federal government. The other problem with that is for a lot of business, it's going to be cheaper to drop coverage and pay the new tax. And so many employees who have coverage now that they're reasonably satisfied with are going to lose it. And just for good measure, the bill forces pro-life taxpayers to, in many very meaningful ways, subsidize abortion. Now, Louisiana is one of the most proudly pro-life states in the nation, so that is particularly offensive. If we really want to put Louisiana first, considering all these costs, we have to say no to this bill. If we really want to put America first, considering all these unsustainable costs, we have to say no to this bill. But we can and we should say yes to the right kind of health care reform. This isn't a debate about yes or no health care reform or not. This is a debate about what the right kind of health care reform is. And to me, we need to start over.